let's just start off, mate. So we're looking at question one. So this question's all about, the world of fitness can be quite competitive, and so how can we enhance customer service experiences? So from your experience, mate, what are some things that athletes can do to enhance their customer experience when it comes to working in the industry?
Yeah, look, the first thing is just obviously understanding the fact that we're talking about customer experience. It's all about their experience. So it's not really about what you're doing or your ego or anything like that. It's all about their experience. And that starts with you building rapport. So rapport is basically like a connection that you have with your client. And if you start and build really good rapport early on, you'll get really good results from your client. They'll also stay with you long term because they can really feel that connection and sort of relationship with you. Yeah. So as you can see here on the slides, you're always looking to try and build rapport with a client, especially early on, looking for some shared interests, some shared experiences, really get to understand who they are as a person. And that allows them to be upfront and honest with you, right? So if you have a relationship with a client where they don't really give you a lot of information, it's really hard for you to sort of program to suit their needs or even just to give them the right type of training experience. So you want to try and build the rapport, but build the connection, ask great questions, and allow them to kind of be upfront and be honest with you. The more they can relax around you, then the better things are going to be. The second thing we're talking about is asking those open-ended questions. So an open-ended question is a question that doesn't just require like a yes or no response. So it requires the person to think, to give their own advice, give their own experiences. And that, again, is going to help you with programming. So don't ask them, are you ready to train today? Yes or no, because then they'll say yes or no. Ask them things like, how are you feeling? What was your sleep quality like last night? Those sorts of questions are asking them to give you a little bit more information. So we always want to look about asking those open-ended questions. The next one is conflict resolution and overcoming barriers. So basically what we're looking at in both of these ones here is every client that you have is going to have some sort of barrier towards exercise or training. That's why they've hired you as a trainer. That's why they've come into the gym that you've worked at. And what you need to do is you need to have answers to these barriers, So for example, if a client comes in and they say, oh, I find it really hard to train really early in the morning, what sort of strategies do you have in place to help them overcome that barrier? Can you give them some advice on what I found really works for me is that I'll put my exercise gear next to my bed. So I know that when I wake up in the first thing in the morning, it's staring at me. I can put it straight on. I can get out the door and I can go exercise. Another one they might say is, oh, look, I really want to exercise more, but I don't have the time. Yeah. So then what can you do to overcome that barrier? Can you write them a 20-minute or a 30-minute workout? Can you give them a selection of exercises that they can do at home? So every time they put up a barrier, what you need to do as a trainer with good customer service is for you to break down that barrier. Okay. So that you've always got the answers sort of to their issues. And then what happens from there is then they just become really consistent with their exercise. The next one is professionalism and timely communication. That's really important. It really frustrates me when I see a lot of trainers that just aren't professional in their look, their appearance, their body language. They're staring at their phone when they're training clients, all that sort of stuff. You've got to create really good habits right from the start. So be really professional with how you look, how you present yourself, and also timely communication. I make it a point whenever my clients text me or email me, as soon as I can, I'm trying to get back to them. You don't want them to email you at midnight and have your phone, going off at all hours. But at the same time, you need to make sure that you are getting back to people quickly. That includes emails, that includes phone calls, that includes new leads and new inquiries. That's really important because, when you're trying to build a business, someone's calling you and it takes you 2 to 3 days for them to call them back. They might have moved on to another trainer, right? So professionalism and timely communication is really, really important. And if you get those habits set perfectly from the start, then it's going to be a lot easier. Then the last one is duty of care. So just, really understanding that as part of your service towards this customer and their experience is you have a duty of care for how you conduct yourself, things like making sure that your client is properly screened before they exercise. You've assessed their risk factors. You've understood what injuries they have. You've referred them to a health professional if they need to. Those duty of care things can't be ignored. Every client, doesn't matter if they're a high-level athlete or an 80-year-old woman, you've got to go through the same process over and over again. And also keeping really good records is important as well. So records of, the number of training sessions you've done with the client, records of their programs, keeping records of their screening forms. And also what's really important is keeping records of their progress, because a lot of trainers, they don't, they might test their clients at the start and they might go 3, 6, 12 months without testing them again. So if you can keep good records and show them, hey, John, we started off doing bench press with 40 kilos, and then in 8 weeks' time, now we're doing 55 kilos, and you can show them that, then again, that's really good customer service, and that's creating a really, really good experience for them. So there are a bunch of different factors. They all come with experience, but what I'm trying to kind of get at here is, making sure that you're really focusing on these right from the start. If you create good habits as a trainer early on with these types of things, then it becomes natural. And it just becomes part of your everyday service that you give to your clients. And that's what separates you from a lot of other trainers that kind of just don't go to those levels.
Awesome, mate. Yeah, thanks for that, Rob. That was really detailed. Thank you very much. So guys, with this question, you need to make sure that you're explaining, each principle that Rob just went through. Then don't just put the dot points down. Yeah, we need to see an explanation. So make sure you do that when you're answering this question. All right, moving on to question 2 now, Rob. So in this question here, we're identifying 6 communication means. So what are ways that you communicate with your clients now, and what do you find most effective?
Yeah, so Leon, there's going to be quite a variety of different communication techniques that you use. We'll go through 6 just as an example. The first one is obviously face-to-face communication. So having verbal communication skills is really important. Making sure that you are confident in your delivery, that you understand what you're doing and what you're saying is really important, because a client can know when you're trying to kind of BS your way through things. So I would prefer to kind of say less and keep things more simple. Don't feel like you have to be super detailed or overcomplicated, because if you start looking like you don't know what you're talking about, then they lose their trust with you. So face-to-face communication is obviously really important. Face-to-face communication is something that's getting lost a lot. We like to go to phone calls. We like to go to text messages. We like to go to emails. We like to go to social media. So developing those skills and those abilities to talk to people face-to-face, that's what we do as trainers. Like, all we do is we spend time with people face-to-face. So make sure that we're doing that. The second one is nonverbal. So nonverbal is basically everything about your body language, right? And we know that there's positive and negative body language. Obviously, you as elite athletes, you understand that as well. I remember when I used to play football, I could pick out the guys on the other team that were showing bad body language straight away. We would focus our efforts on attacking them. They look tired. They look like they're not interested, So you've got to make sure that your body language is up and about. Remember, you're the one that's providing sometimes the energy levels, the motivation. You're setting the tone. You're setting the standard for the session. So your body language needs to be there as well. Okay. So that's really important. So body language is everything from how you hold yourself, the sort of non-verbal cues you give, like high fives, pointing, directing, making sure that you're not standing there with your arms crossed all the time, which gives off negative sort of body language. So making sure you're consistent with that as well. Third one is obviously written communication. Okay, so obviously we're sending our clients texts, we're sending our clients emails. It gets really easy to become quite conversational and quite kind of buddy with some of the texts and emailing. Trying again to always just leave a little bit of some professionalism with your communications with your clients there. Like we said before, making sure you're communicating with them quickly and replying to them, but, making sure that you are writing, professional emails, professional text messages. Again, it's just a good habit to get into. A fourth communication method that you might use is, if you're working, say, as a gym instructor, is you'll have group communication. So you might be working in a gym with all these other different fitness instructors, and you guys might never see each other because you're working different shifts or whatever, but you need to be able to communicate with each other. So you might have text message threads, you might have WhatsApp threads with other staff, you might have the old school version, that I grew up with, which was the logbook in the gym, where if there was an issue, a trainer would write it down and you made sure you read the logbook before your next shift. So group communication is really important, right? And it's important for you to contribute to the group. So if you see something, if something comes up, if you've got an idea, if you've got an issue, if you wanted to give, tell the other trainers to give a shout out to another client or another member on the gym floor to help boost their motivation, all those sorts of things are really important. So make sure that we are communicating in a group. And again, making sure that we're keeping it professional. Okay. Another communication medium that you might have is you might be working with other health professionals. So we call that allied health professionals. So these are things, people like physiotherapists or massage therapists, general practitioners, GPs most commonly. So you will be dealing with them. So again, a level of professionalism is important, making sure that you're writing your referral letters, which we're going through within this module in this course, and making sure that you're communicating timely with them as well. So, if a massage therapist or a physiotherapist sends you an email with some instructions for a client, make sure that you're replying and saying, yep, I understand. I'm going to be including X, Y, Z in the program. Last one, guys, is phone calls. Okay. Again, try and keep this method of communication open with your clients. Don't try and push everything to text message. Don't try and push everything to social media. I'm still big on phone calls. I still call my clients all the time because I think it's really important to kind of check in with them. You can even do things like you might block off a certain time in the week. So I used to do Monday mornings. I used to spend half an hour, and all I do is I call 4 or 5 of my clients and just check in, see how they're going, see what they've got planned for the week, just confirm their training sessions, give them 1 or 2 reminders. Hey, it's time. We talked about really eating well. We talked about not going out this week, those sorts of things. So as you can see, there's a lot of different ways that you're going to be able to communicate with your clients and with your colleagues. And it's important that you remain, timely and professional in all the things that you do.
And just quickly, mate, how important is it, we might only see a client once or twice a week. How important is it to actually be communicating with them consistently throughout the week, to create that good service?
Well, I think it's vital because if you really think about it from a simple time perspective, you might only be spending an hour and a half or 2 hours a week with your clients. So it's another 140 plus hours of the week where they're left to their own devices, So they might not be sleeping well, they might not be eating well. And so you just being in their ear a little bit once a week, or the odd text message, the odd phone call, just to tell them that, that you're thinking about them and you're with them on their journey, especially if they're trying to make progress, is really powerful and really important. Okay. Because again, you'll get frustrated if your clients keep turning up to training once or twice a week, but they're not doing everything else outside the gym to kind of assist their health goals. They're not walking, they're not getting a good night's sleep, drinking less alcohol. So if you can kind of communicate with them about those things, it doesn't have to be all the time, might be once a week, once every 2 weeks. People really appreciate it because, it just shows that you're thinking of them.
One thing you haven't put in there, man, I just wanted to quickly touch on it because I know a lot of the guys doing the course are younger. Do you look at communicating with people through social media as something that you could do as well?
Most definitely, yeah. I'm not saying don't communicate with people through social media because that's their preferred medium of communication. Then that's fine. What I typically do with clients and with new clients, people coming in, is whatever sort of the first method of communication we started, we kind of try and keep it going that way. So if a client calls me over the phone, I typically like to try and call them on the phone a lot. If a client texts me, I try and text them. If a client messages me on Instagram, I'll try and sort of message them through Instagram. So I like to kind of use the same sort of communication medium every time. It's definitely good, but at the end of the day, if you're trying to create more of a one-on-one relationship, if they become your client, you might be better off sending them a private text or a phone call or something like that, just to kind of let them know that you're thinking of them. But social media is definitely an option.
Awesome. All right, let's move on to the next question. All right, this question I put down, mate, it's a very interesting one. And the reason why I put this question down is because this is a real scenario that has happened before, and it is really important for athletes to understand their duty of care and their professionalism towards if they are in a situation when they are working within schools. And I think that's something that a lot of athletes do. So how they can make sure that they're prepared and they're acting to the duty of care they need to. So in this question, we're talking about working with some year 10 students, and one of the female students adds an athlete onto their Instagram after later on in the session. So what are the legal and ethical limitations that as a fitness professional you're bound to if this situation was to occur? So just want to quickly run through how you see this question.
Yeah, definitely. No, look, there are kind of 2 approaches that you could take with that. I might highlight both. But I think the first 2 points are really important. Is we need to understand what our duty of care and what we're bound to legally and liability wise in terms of a fitness professional. So the first thing is your duty of care is bound to the safety and well-being of the client and student more than anything else. We need clear, honest and accurate communication with your clients and other colleagues, and not misrepresenting yourself as a fitness professional. So they're two things that I pulled directly from sort of like the Fitness Australia sort of code and conduct sort of sheet, right? So the third one as well is avoiding any inappropriate behavior in all client relationships, ensuring physical contact and any communication is appropriate and necessary and undertaken with client's approval as well. Okay, so this is where this question becomes tricky, because it wasn't you obviously adding the person, it was them adding you. Now, I'll give you like a short answer, and then we can maybe Leon and I can discuss sort of a second more roundabout answer. So from my perspective, for this scenario, because they are an underage client, they're under the age of 18, okay? You are a third-party provider, okay? As you are an employee or subcontracted to the school, they are not a direct client. I think that those provide two simple risks, right? So you want to think about here is, what is the risk versus reward of this scenario? What is the risk of them adding you on Instagram versus what is the reward of them adding you on Instagram? It could be just one more follower, but it could be running into some direct message issues, you know, which we all know can lead to other things, your photos and whatnot, okay? So for me, I would say the easy answer is no, to create and set a standard. Now, there might be some differences if you have, for example, a personal Instagram page versus maybe like an athlete Instagram page, because again, those lines maybe blur a little bit more, but I would definitely be not contacting this person directly, again, for those reasons that I outlined, which was the underage client and the fact that also you are a third-party contractor as well. So again, you're not affiliated with the school, you know, you're just coming in as a third party. What do you think, Leon? I'm interested to hear your thoughts, mate.
Yeah, so this happened with, you know, a long time ago, probably about 4 or 5 years ago now. We had an athlete that was doing the course and went out and worked at a school for their practical placement, and this, you know, this scenario arose itself. And yeah, for me, it's very simple. It's just, you know, you're there to take that client or take those group of clients through some sort of fitness program. You're not there to build a relationship with them outside of the school. And the fact that, you know, they are minors, they're under the age of 18, but the fact that you know, they're at school too, you know, is for me, it's very clear cut that, you know, you should not be doing anything. And if anything, reporting that to the school or reporting that to your supervisor or to the company that you work for that this has happened is really important to do as well, because, you know, you want to make sure from the get-go that you're very clear and honest and open about the situation so that you don't get in trouble. So what I would be doing is, you know, making sure, one, you're not communicating with that student, but the second thing is speaking with, you know, your supervisor or the company that you work for, and getting them to contact the school and letting the school know what has happened, so that it shows that you're taking initiative and you understand this is the wrong thing to do, and that, you know, you're stepping away from it and showing that you're responsible. That's the way I'd look at it.
Yeah, definitely. As you can see, what I've written down the bottom there, it's, you know, if you take 20 seconds to think about the risk versus reward of this current situation, there's a whole lot of risk and there's very little reward, right? So the easy answer, again, if you want to create and set a standard with your business and with who you are as a fitness professional early on, we just say no. And it's just something that you say that this is just what I don't do. So.
Awesome. All right. So yeah, guys, with this question, it's what are the legal and ethical limitations that you are bound to in your role as a fitness professional? So Rob's just gone through those. So you just need to talk about what are you bound to? And, you know, we spoke about those, you know, throughout these dot points. So just going through that and putting that in your own words is what you have to do for this question. All right, moving on to question 4 now, mate. So we're looking at here, you know, all the people that we could potentially refer clients to, and what those, you know, those allied health professional roles would be when referring them. So let's just go through them one by one and kind of talk about why you would refer a client to each one of these allied health professionals. The first one is a personal trainer. So, you know, if I'm working on a gym floor and I'm talking to a client and or a member and they're looking for more specific specific training, why would I refer them to a personal trainer?
Yeah, so I think, look, the first thing is that's the obvious referral network there is from a gym instructor on a gym floor, referring them to a personal trainer. If a client has, sort of any general sort of programming advice, if a client with a basic sort of need or goal. So typically we're looking at sort of body composition training. So body composition being, looking to lose fat, maybe gain lean muscle mass, change the way they look, feel and perform, then any sort of general basic sort of fitness programming, I think is best referred to a personal trainer. And again, another really vital thing is just some people just want consistency and accountability. They want a program. They want to be able to walk into a gym and go, okay, this is what I'm doing today. I'm doing it this times a week. Tuesday, I'm doing this. Thursday, I'm doing this. And I want somebody to hold me accountable to it. So, at the end of the day with personal training, the consistency and the accountability is where the results come from. So you want to really focus on that. So there's, two basic reasons why you would refer a client to a PT.
So the next one we have down here, mate, is an advanced personal trainer. Now, just quickly before we get into this, what is the difference between a personal trainer and an advanced personal trainer?
Yeah, so for me, how I would explain an advanced personal trainer is could be somebody that has gone on and had a few extra qualifications. Say instead of a certificate 4, they might have a diploma in fitness. They might have a specific background in training clients with certain types of injuries, issues, medical conditions. Okay, they could be an exercise physiologist as well. So I think people that have had that maybe that little bit extra understanding or experience. Okay, so it could be someone who's had 15, 20 years of experience as well, but still only has their Cert 4. Okay, so it's just that next level of sort of personal trainer. And as you can see here, the types of clients that you might refer someone to an advanced personal trainer would be what we call special population clientele. So these are people that have health risks or medical conditions, could be high blood pressure, could be diabetes, could be those sorts of things that you might need an advanced personal trainer. Someone that's worked with those clients before, as opposed to just a basic PT. Another one is you might have a client with an athletic background and it's got sports-specific goals or programming. Again, if I had sports-specific goals, I would go to a trainer that had that athletic or that sporting background that understands that. Maybe they've done a strength and conditioning qualification as well, right? So as athletes, you guys might be really well placed to look after these types of clients, with an athletic background, doing a similar sport, or have similar goals based upon that sport. And then the last one is maybe injury rehabilitation, right? So if a client comes in, they're rehabbing a knee or a hamstring or a shoulder, then you might be sending them to an advanced personal trainer that's had experience with that. And they may be working alongside the AHP, which is the allied health professional. So they might be working alongside the physiotherapist or even like an orthopedist or a surgeon or something like that to kind of create a time frame and sort of an exercise progression for recovery. So I think those three, the special pops, the athletic, sports specific, and the injury rehab, I think they're probably three of the best sort of people to refer to an advanced PT.
Awesome. All right, moving on to the next one now. Now we've got just our general practitioner. Now, obviously, very wide scope here for a general practitioner. So, yeah, who would we refer and why would we refer clients to GPs?
Yeah, so look, in terms of GPs, what you will find and what I've definitely found through the industry is a lot of GPs don't actually have a lot of specific exercise understanding or background or knowledge, especially some of the older GPs. So you're not really going to them to look for exercise advice. They're coming to you to look for exercise advice because you're the person that studied it, right? But what they're looking for here is clearance to begin a training program, okay? So if we assess their risk status on their pre-screening and go, okay, look, you've got too many risk factors, or you've ticked yes to, stage 1 of the APSS, it's time to send you back to the GP, okay? What a GP might also do is they might diagnose some issues, right? So if you've got a client that's really struggling, they've got low energy, they're having issues sleeping, their results are down at the gym, you might send them back to the GP and the GP might go, okay, let's run a blood test and let's see if you're low in iron. Now, obviously, that's not something you can do, but that's something that the GP can do. And lastly, obviously, it's a legal liability to yourself as a fitness professional that if a client is high risk, they need to be cleared before they begin an exercise program, right? So it's usually the assessment of risk and the clearance of a training program is why you would send a client back to a GP.
Awesome. All right, next one now is physio. So physiotherapist, why would we refer someone to a physiotherapist?
So just like we talked about before with the diagnosis of medical conditions or illnesses, the physiotherapist, we're looking for diagnosis of injury. Now, as a PT, we're not allowed to diagnose injuries. All we can do is we can refer someone to like a physiotherapist who can do that. So they might diagnose an injury. Okay, yep, you've got a high ankle sprain. It's a grade 2. We're looking at 6 to 8 weeks. Here are some here's a treatment plan. Here's what we're going to do in the first 2 weeks. Then the next 2 weeks, we're going to progress to these exercises, these exercises, these exercises. So working alongside physiotherapists are really important and really helpful, because they'll give you guidance on the types of exercises you do appropriate to each stage of their injury. Because as you guys are aware with athletes, you guys are athletes, there's an early stage, there's a middle stage, and there's a late stage of injury. And what we do in the different stages is really vital. We don't want to give clients to advanced exercises. If they've just blown an ankle, we don't want to give them plyometrics or change of direction exercises at the start. We give them to those at the end. Okay. And the last thing as well is we might use physiotherapists for manual therapy techniques, massage, ultrasound, laser therapy on joints, taping as well. So they've got issues with shoulders or ankles, we can refer them for that also.
Awesome. Let's keep moving on. So next one, we've got occupational therapists. So I think this one, can you quickly explain, mate, in your own words, what is an occupational therapist, and then why we refer them?
Yeah, so an occupational therapist is a health professional that really deals with helping people improve manual tasks for their everyday living. Okay, so if you think about what we do on everyday living, it's things like getting up and out of a chair, walking up and down stairs, grabbing and gripping and holding things, carrying things. So those basic tasks are typically someone that an occupational therapist will do. So they do a lot of work with feet, they do a lot of work with hands as well. Okay. And they do a lot of work on like balance and control and sort of nervous system training. Okay. So assistance with fine motor tasks. If you've got an older client that's having issues with, say, gripping, they're very unstable, they're losing a lot of balance, you might go see an occupational therapist. And also if they've had any sort of accidents or injuries, the first thing that comes to mind is like a client who's had a stroke, like them learning how to use that side of the body again and firing the right sort of muscles is definitely something that you use an occupational therapist for. So, they're the type of people that you would work with. Typically the older clientele, so typically people sort of, 60 plus, and people that have had either like accidents or they're losing, sort of motor skills in their hands and feet, or they're losing balance issues.
I think a big thing I want to kind of highlight here, especially with occupational therapists, is it's not always that you have to refer the client to them. You could just be giving an occupational therapist a call just to chat to them about a client and to get some feedback off them. Is that something that you do with the clients that you work with?
All the time, because what I want to do is I want to understand sort of like if I can give a generalized assessment of this is where my client's at, if I can get 2 or 3 or 4 exercises that I haven't thought of that could really assist my client, then that's fantastic, and also it's important that if the occupational therapists do give your clients exercises, they let you know what exercises they've given them so that you don't end up doubling up and doing the same thing over and over again. So like with all these health professionals, it's important that you guys work together, that you create a connection and understanding so that you're all moving and pushing in the right direction.
Fantastic, mate. All right, so next one, chiropractor. So why we refer a client to a chiropractor?
Yeah, so look, I don't refer a lot of clients to chiropractors because clients will typically take themselves sort of to chiropractors. I don't think that like excessive joint manipulation is massively important for clients. We as trainers, we focus a lot on more like exercises to strengthen, improve posture and work on flexibility. But you will have clients that go see chiropractors for sure. So they want their joint and spines aligned. They might be having some neck pain, some shoulder pain, to help to kind of create that alignment. Also, they may be getting their posture assessed, which is actually a good reason to send one. If you've got clients who've got really bad posture, you may want to send them to a chiropractor. Could also send them to a physio to get an understanding of what muscles are really tight, what muscles are really weak, right? But I think what the most important thing is if a client does go see a chiropractor, it's not about just cracking them and then sending them back to you without any like understanding of why did you get here in the first place. So a good chiropractor will do the adjustments, but then they'll say, okay, the reason why you're getting to this point is because this muscle's weak, this muscle's tight, you do this stretch, you do this exercise. So it's really important that you get those exercises from the chiropractor because then you can basically work on improving their posture and their joint alignment in your sessions.
Awesome. All right, podiatrist. So let's just quickly, what is a podiatrist and then why we refer them?
Yeah, podiatrists are feet doctors. Okay, so they typically deal with lower limb injuries, feet. They deal with things like gait, which is actually really important to how you walk and how you run. Because for a lot of athletes, what they don't really understand is that running is actually a skill. And if you haven't been taught how to run properly, if you're running incorrectly over time, that can cause a lot of issues. So as you can see, podiatrists are going to assess any sort of lower limb foot injuries. Could be shin splints, it could be ankle issues, it could be like plantar fasciitis, like pain in the bottom of your feet. So all those things, assessments and diagnosis of that are done through podiatrists. They might prescribe orthotics, okay, which we all know are the foot inserts that might go into your football boot, they might go into your running shoe. That can help sort of, create an arch if you're if you're like got flat feet or something like that. That can help to reduce the risk of sort of lower limb pain, shin splints. Rehab and strengthening advice. Okay, here are the exercises we want to do. We want to strengthen these muscles. We want to strengthen the muscles around your feet. We might want to stretch your calf muscles. Your calf muscles are too tight. And then the last one we put down was gait analysis. Podiatrists are great because they get you watch you walk, they watch you run, and they go, okay, you're having an issue here and it's because of this muscle, or you're having an issue here because your technique is wrong. And I think the gait analysis is really vital, because if you can get an assessment of how they walk and run and work on fixing that, then there's less likely that they'll get injured in the future.
So a question I want to ask you here, Rob, is that do as a fitness professional, do we just send them straight to the podiatrist, or would we get them to go to a GP then to be referred to a podiatrist from the GP?
Okay, that is a really good question. You could do it either way. Okay. Usually podiatrists, you don't need a specific referral to see a podiatrist from a GP. Okay. You can just book yourself in with a podiatrist, but the GP might be able to assess some other issues. So if you've got pain in the feet, it could be, an issue that a podiatrist might fix, but it could be something like gout, whereas basically you've got like an issue in your blood, you might need a blood test as well. So, I mean, the safest way is to always send them back to a GP. But also if you've got a client that's got, I've always got a sore foot, I've got a sore ball of my foot, I've got a heel spur, I've got something that feels like it's burning on the back of my heel, then you can send them directly to a podiatrist, yes.
Awesome, man. All right, next one, a massage therapist. Now, I know when I was doing a lot of training, this was probably the main allied health professional I'd always send my clients to. So why would we send our clients to a massage therapist?
Yeah, the massage therapist is probably the first person that you'll deal with in terms of allied health professionals, and the one that you'll deal with the most. And the benefit of that is if you send clients to the massage therapist, you give them business, there's a very good chance that they'll send clients to you, and you'll kind of have this sort of working relationship where you both get business off each other. So obviously soft tissue treatment, tight, stiff, sore, aching, loss of range of motion, all those things can be done through manual therapy, soft tissue treatment, and also just for stress relief. If your client's been training a lot, if they're really working hard, if you can tell that they're stressed, they're under the pump at work and they're trying to train, everything's tight and stiff and they're wound up, their blood pressure's up, they're not sleeping, hey, go for a massage just for stress relief, just to relax as well. So it's not just used for joint and muscle injuries and pain and tightness, it can also be used for relaxation. But definitely somebody that you'll use quite a lot.
So for me, I know when I was doing personal training, I would also use them as a reward. So for me, I'd be like, all right, if you don't miss a session for a month, I would reward them with a massage. But I think it was just a long-term plan for me. I wanted to make sure that my clients could make training and over a long period of time. And so by even if it's just once a month referring them to a massage therapist, that would mean that they would be able to continue training over a long period of time, because they were getting that therapy that their body may need because of all the training that they were doing.
Yep, definitely, it's a great idea.
All right, next one, yoga instructor. Bit different, refer clients to yoga instructors.
Yeah, so yoga instructors, it might be something that's just a little bit outside your scope as a gym instructor or a PT. You might have a little bit of an understanding of some basic stretches, but a yoga instructor can give you a much more of a holistic sort of approach to improving someone's flexibility and mobility, right? So we need to understand there's a difference between flexibility and mobility, okay? So flexibility is just basically the length of a muscle, right? So it's how much can you stretch your hamstring? How flexible is your hamstring? The old school sit and reach test is flexibility. Mobility is how does the body move through its range of motion? Is there anything that's tight or weak in a specific range of motion? So a difference would be like a basic sit and reach test is for flexibility, but watching somebody squat all the way down and all the way up and seeing if they can squat with a full range of motion, that's looking at mobility. And mobility is usually not just one area that's tight or one area that's not working, it's a bunch of different things. So yoga is great for both. Not only does it improve flexibility by holding the stretches, But by getting yourself into new positions and opening the hips and working on shoulder mobility, you can really see some improvements in the gym. Great for core strength as well. Okay, so if your client's having issues with core strength, engaging their core during certain lifts, great. Mindfulness and meditation, again, stress relief, nervous system down regulation, I call it. So we're trying to calm the nervous system down. So, a regular yoga practice is fantastic. I teach a lot of it. I teach at least 3 to 4 corporate yoga sessions and a yoga session at a gym up here per week. It's a benefit for me because not only do I get paid to do it, but also I get to stretch at the same time, which is great. So some form of yoga instructing and getting every client to, thinking about doing it at least once or twice a week to sort of improve the training sessions with you are really important.
Just quickly wanted to touch on here, mate, and just get some feedback from you. I've had first-hand experience of this with my dad, but the importance, with stress relief and hormones too. So making sure if you want to lose weight and you've got high level of hormones in your body, then that makes it quite hard to lose weight. So having stress relief to make sure your hormone levels are at the right level so that weight loss can occur. Is really important. Do you want to quickly just touch on that?
Most definitely. You could speak for almost an hour on the whole concept of hormones and weight loss, but essentially what you're looking for is there's 2 competing nervous systems in the body. There's the fight or flight system, which is, the one that's supposed to get us to run away from the saber-toothed tiger when we were cavemen, right? And that's the one that we engage a lot when we're busy and stressed at work, when we're doing really hard training sessions. That's the fight or flight system. It's great to do that one for short periods of time. But the problem is if you're doing that all day long, hard training, lots of work, no sleep, bad food, lots of alcohol, then those stress hormones just keep rising and rising and rising and rising. And when the body gets put into stress as a defense mechanism, it goes, okay, I'm in a stress position. So I'm actually going to shut down a lot of my body systems, including my metabolism. I'm not actually going to burn a lot of calories. I'm also going to eat a lot more because I'm under stress. So it creates an imbalance through sort of burning calories and also eating more. And that's where weight gain can occur. So it's almost like sometimes less is more. So if we can do any exercise to kind of calm down and relax the nervous system, bring the nervous system back down, then we can be in a better position to actually burn more calories and lose a bit more weight.
Thanks for sharing, mate. All right, next one, osteopath. Again, like a couple of these allied health professionals, could you just quickly touch on what is an osteopath and then why we would refer clients?
Yeah, osteopaths are almost like a combination doctor between like a physiotherapist, a massage therapist, a little bit of an occupational therapist. They deal with bones and joints. So they're looking for diagnosed bone and joint problems, okay? So if you've got specific issues with knees, ankles, hips, shoulders, it could be bursitis, it could be knee replacements, it could be all this sort of stuff, that they're the doctors that focus on that. And typically you'll need to go through a GP to see an osteopath, okay? Diagnose bones and joint problems and rehabilitation and programming to assist with these sorts of injuries. It could be like, car crash, shattered femur sort of stuff. It could be like, like I said, impingement issues in the shoulder that might need specific exercises. That's when they'll typically see an osteopath.
All right, now this is one close to you, mate, because you are an accredited exercise physiologist. So what is that and why we would, a PT like myself refer someone to you?
Yeah, look, very similar to the advanced personal trainers, but just again, probably another level up. We think of the concept of exercise as medicine. We're basically like doctors of exercise, except we're not doctors, right? So just as you go to a doctor to get antibiotics when you're sick or to get, pain relief or whatever, we prescribe exercise just like a doctor prescribes medication in order to improve your health status, okay? So it's an actual prescription. So we understand the body systems, the anatomy, the physiology. We specifically understand medical conditions and those sorts of issues. And we're looking at reducing your risk factors for your disease, improving your quality of life, improving your longevity, reducing the reliance on medication as well. So we know all the ins and outs of all the specific medical conditions, what you can and can't do, what's best at this stage versus what's best at this stage. So clients with specific medical conditions, again, an exercise physiologist is really, really useful to use.
Awesome, mate. Let's keep moving on. All right, so we're on to question 5 now. So in this question, we've got a little bit of a scenario with John and Matt both attending a gym session. John decides to have a fitness consultation and a fitness appraisal with a trainer. over the next 3 months, John, was assess every 4 weeks. And so what this question is asking here is what are the benefits that John has in receiving fitness appraisals over with Matt not doing a fitness appraisal with a fitness professional?
Yeah, this is a great question because we're basically looking at two people coming into the gym for the first time. One person walks into the gym and goes, "Oh, it's okay, I'm cool, I'll just do my own thing," and they end up kind of, as we all did when we first started in the gym, wandering around aimlessly. I'll do a bit of this today, I'll do a bit of that today. I might come back tomorrow, I might not. So it's the lack of direction that really hurts, right? But if John comes in and gets a fitness appraisal, you can see all the things that John's actually going to get, okay? So the first thing that's going to happen is we're going to get an accurate assessment of where he's at with his health, So we're going to check his risk factors. We're going to look at his body composition, how much fat, how much do you weigh, what's your lean muscle mass percentage? So LBM is lean body mass, how much muscle are you carrying, what's your body fat percentage? Visceral fat is the fat that sits around the organs that's related to health risks. You can do that through, if you've done any sort of like body scans and things like that, it'll tell you that. So these are all really important measures because it gives us a starting off point. It goes, okay, John, we're starting here. Let's set some goals and let's work from here towards there, okay? What he also gets is he'll get some fitness testing. So not only we're looking at how he's looking, but how he's performing, okay? So he might do, push-up test, squat test. He might do some sort of treadmill cardiovascular fitness test or a bike test. And then we can see where his levels are at. We can compare him to other people of his same age, right? So before he even starts in the gym, we know exactly where he is. So now we can give him specific programs that are aimed to suit his needs and goals, as opposed to Matt, who's just kind of walking around the gym going, "Oh, I'll do a bit of this, I'll do a bit of that," right? The third thing that's so super important with all this is he's going to get consistency and he's going to stick to the program because he's going to get something that he can follow. A first timer in the gym really needs assistance. They need something they can follow, that they understand what they're doing, they understand why they're doing it, and they'll do that a lot more consistently. If you're going to the gym for the first time, you might only know 5 or 6 of the pieces of equipment. You'll do the same 5 or 6 pieces of the equipment every time, okay? So it's important that we have a program they can follow, they can be consistent. Another important thing is they're going to get feedback from the trainer. So rather than getting lost in the gym, in a big gym where no one's speaking to you, no one's going to help you, the trainer's engaged with you at the start. He's going to come over and say, "How's everything going? How's the program going? Do you have any questions? Oh, you're doing better at this exercise. Here's a harder version. I suggest you put more weight or less weight on this one." And then the last thing is, in every 4 weeks, he's getting tested so he can track his progress. So for all those reasons, he's going to be much more consistent. He's going to stick to the program. He's going to get results, as opposed to Matt, who we all know just kind of floats around the gym. And they're the type of people that typically come for 2 or 3 weeks and we never see again.
Yeah, man, this is huge for me too. Like, direction is so important, and having something to focus on, especially for people who aren't an athlete, who don't do the gym all the time and don't train all the time. You really do need to have something that you're focusing on, and fitness testing is a great way. If a client doesn't have, a specific goal that they want to achieve, fitness testing is something is their goal, that they can write, next time, let's set a target of achieving this goal, in 4 weeks. So then they've got something to work towards, and that consistency is so important. Really, really important. All right, question 6, just outline the following health-related components of fitness. So just quickly touching on each one of these, Rob, and why they're important would be great.
Yeah, so this is where we're getting into a little bit of the physiology, so understanding sort of what all these things are and how they actually help in terms of your health, okay? So what does an improvement in body composition actually mean, okay? So the first one, body composition, is looking at what is your body made up of, okay? So we've all got, the same number of bones, the same organs, but it's basically looking at is what's happening with our muscle mass levels, our lean muscle mass, and what's happening with our body fat percentage, okay? Typically, when we're looking to improve your body composition for your health, we're looking to increase the muscle mass and at the same time decrease the body fat percentage, okay? That's what most people want when they go into a gym. And so that's what we're looking at, body composition, the percentages of muscle versus fat within the body, okay? That's the first one. Now, the second one is muscular endurance, okay? So what is muscular endurance and how does that improve your health, or how does that improve your performance, okay? So we understand endurance and muscles, okay? So it's our ability to contract our muscle over and over and over again before we get tired, okay? As we all know, When you start a training program as an athlete, you know, pre-season, fitness levels are down, muscle endurance levels are down, everything hurts, everything burns, and we slowly build up that tolerance over time, okay? So as you can see, it increases our body's ability to tolerate lactic acid, which builds up during hard, long training sessions. So we can tolerate more of that. We can kind of clear it out of our system. We can go harder for longer. We can improve our repeat effort ability as an athlete. That's really important, being able to go again and again and again, especially if you're in a sport that's very stop-start. You know, you don't want to have the first 3 efforts at 100% and then, you know, the next 3 efforts are at 20% because you've completely blown out. You've lost all your endurance. And then if your muscles are more endurant, there's a decreased injury risk, okay? If they're going to fatigue less, they're less likely to get injured, which is always one that we tend to forget about, okay? So I always say the reasons why we want to get more endurant in the gym is it's going to reduce our body's ability to get injured as well. I'll just go into the third one, Leon. Yeah.
Yeah, mate. Okay, let's go move to the third one.
Yeah. So flexibility. Okay. So what are we looking for here? Well, flexibility is going to increase our joint ROM, which is range of motion. So our joints, we're going to be able to move our joints through a bigger range of motion because the muscles and tendons are going to be able to lengthen more. Okay. That's flexibility. Okay. So it's not the reason why the joint gets more flexible is because the muscles and the tendons surrounding the joint become more flexible. The third thing is, just like muscle endurance, decrease injury risk. Typically, if we're more flexible, we're going to be able to take our body through larger ranges of motion, less chance of injury, improve posture for sure with flexibility, and then improved exercise technique. An improved exercise technique does 2 things. You get more out of the exercise and it reduces the risk of injury. So more reward and less risk with that specific exercise.
And the reason why we're looking at these 3 in particular is because of the aging population of Australia. And, you know, as we get older, our body composition probably becomes a little bit worse. Our muscle endurance becomes a little bit worse. Our flexibility becomes a bit worse. So, you know, as a fitness professional working on these 3, health-related fitness components are really important with majority of our clients. Would you agree?
Yeah, definitely. You know, everybody wants to come in for body composition, but what they probably don't realize is a lot of other things they need to work on. You know, if we improve their flexibility, they can do their squats better. They're going to get better results in their body composition. So it's not just looking at just at one thing, but all these things are kind of linked together. And again, as people are moving less and less and getting more and more unwell and just poor health status, these things are vitally important.
All right, now moving into our last question for this assessment is question 7. So we've got a couple of scenarios here and we want to look at some contradictions and precautions that may arise when training these clients. So the first scenario is a client, let's call him Tate, and he's injured his foot playing OzTag. So what are some contraindications and precautions when it comes to his training?
Yeah, so so this question kind of relates a bit more back to sort of like when completing a health and fitness appraisal, right? So if I'm going to do sort of testing protocols or procedures on this client, they can walk into the gym. Obviously with Tate, with injuring his foot during OzTag, there's all the sort of lower body fitness testing that I would have done with him. I'm going to substitute that out for something else. Like Tate's not going to run a beep test. Tate's not going to do vertical jump tests, you know, especially if I want to do all these athlete sort of versions of testing. So we're going to have to change that up a little bit. And the testing just might have to be postponed until after Tate has recovered. Now, in terms of general training, obviously we need to understand how bad the injury is, what stage he's at, and making sure that we're giving him appropriate exercises at that stage. And usually it's going to be low impact exercises for Tate if he's got an injured foot.
All right, so next one is a client named Chris who has chronic asthma. So how do we have to change his fitness appraisal to make sure that, you know, we're looking after him?
Yeah, now just because Chris has chronic asthma doesn't mean he can't perform the testing. We just need to make sure that we take some precautions. So the first thing is he needs to have his puffer with him and he should use it before any fitness testing procedures. And he should do that every time just to make sure we're consistent, okay? Because if he uses his puffer one time, he does a fitness test, but he doesn't use it the next time, the results might be different, okay? So that's important. The second thing that's really important is if the client's got asthma, you need to keep an eye out during the testing for if he's struggling, if he's showing what we call signs and symptoms. So some of them I've put in there. The first one is SOB, that's shortness of breath. We all know what that's like, okay? So you know, if his shortness of breath is a lot more severe than we expected, we might need to stop or slow the test down. If he's wheezing or gasping, obviously, you know, he might be having an asthma attack, we need to stop. The last one is cyanosis. I know it's a big fancy word. It just means if his extremities start changing color, if he goes real pale or even blue in the lips and the nose, which can happen with clients with chronic asthma, then we need to stop. Okay, so it's really important when we're doing these fitness tests that we're taking a really close eye on his signs and symptoms. And I probably wouldn't even do any tests unless he's had his asthma puffer. And then understand is if he does have an asthma attack, is what is our plan for that? And do we know asthma first aid? Okay, which we will cover in the first aid portion of this. But basically with asthma first aid, you give him 4 puffs and he takes 4 breaths each puff. And then we rate 4 minutes and then we do it again. Okay, so it's called the 4-4-4. So understanding how to deal with that is really important. So if he has an asthma attack, we stop. He has 1 puff, he breathes 4 times. He does that 4 times and then we wait 4 minutes and then we do it again. And hopefully he'll start to improve from there.
With clients with chronic asthma, is also important with the environment that we're training him in and making sure that that environment's important, because you know, there are some environments that can actually bring on asthma. Is that right? Yeah,
that's good. That's actually really good, Leon. That's something I didn't consider for this answer when I wrote it down, is that cold, dry environments are really tough on asthma people. So if you can think about it right now, June in Australia, very cold, very dry. So it's harder work on the lungs because the lungs have to warm up the air and have to moisten the air before you can kind of process it, okay? So I'd be avoiding a lot of cold, dry environments. So indoors might be useful for fitness testing. And if you are having to do things outdoors, you've got to be even more mindful of these symptoms. Maybe start a lot slower, give him a little bit of a longer warm up, allow his body to kind of temperature to rise before you start any tests.
Awesome. Right. And our last client and the last part of today's class is Wendy. She's a 65-year-old female who hasn't participated in any exercise in the last 15 years. So how would we deal with her when it comes to fitness testing?
So the first thing when I read this is that I'm probably assuming that Wendy's going to have some other risk factors. If she's 65, she hasn't done any exercise in 15 years, there's a good chance she might have high blood pressure, she might have cholesterol issues, she might have a few other things. So there's probably a very good chance she'll need a GP clearance prior to beginning the fitness testing. So she'll fill in the APSS screening form and we'll make sure we do a full assessment of her risk factors. And if she needs clearance, then we won't do any testing that day. We'll send her off to clearance. Once she gets clearance, then she can come back and do testing, okay? If we do fitness testing, we keep it very low intensity and very non-invasive. So we don't do a lot of the hardcore, like Wendy's not doing a beep test. What Wendy might do is what we call the Rockport walking test, which is basically you've got 6 minutes. Let's just see how far you can walk in 6 minutes. Okay, that's a fitness test that's a lot more specific to Wendy for her age and for her health status. And then just like Chris with chronic asthma, we make sure we monitor closely for signs and symptoms throughout the session. There's a good chance she'll get quite fatigued. She might get a little bit dizzy. She might get a little bit short of breath. She might get really red in the face, huffing and puffing. So make sure that we're monitoring that and hopefully not giving her anything that she can't handle.
Well, thank you so much, Rob, for jumping on today and going through all these questions. We really appreciate it. And, guys, when you are doing these questions, again, it's really important that, you're just answering the question, being very specific with your answers and, just giving the detail that we need, but not overdoing it as well. You don't have to give us pages and pages and pages for these answers. Just making sure that you are answering the question is what we're after. So, once you finish this, hand it in and we can, Rob and I can both look at it as long as we've paid to make sure you've got it right. But if you do have any questions, please just get in contact with us.
Fantastic. Thanks, Leon.
Thanks, Matt.